Drug and alcohol abuse in pregnant women is quickly becoming a prominent issue in the city of Baltimore. This has led to adverse effects on infants, such as birth defects and a continuous cycle of addiction. Due to the lack of education and awareness, women in Baltimore are more likely to suffer from complications during pregnancy. 60 to 70% of women report being counseled on the risks of alcohol, smoking, and illicit drug use. Pregnant women who are abusing drugs and alcohol are unaware about the harmful effects of substance abuse on not only themselves but also on their unborn child. In general, people have become more dependent upon their primary care physicians for specialty needs. However, this issue is more prominent in economically depressed neighborhoods where healthcare needs are not a top priority or are often deemed unaffordable. Because of this, many women in Baltimore go without proper education of pregnancy and the post-pregnancy practice. Key players that can influence or are affected by this issue are healthcare providers, pregnant women, and the newborns. Substance abuse is associated with preterm labor, lower birth weights, fetal deaths, and many other pregnancy complications. It is necessary for physicians to address this issue to expectant mothers and their families, as it has a lasting effect on their lives and their child. Providing appropriate information and care will result in healthier and successful pregnancies. As states across the country continue to combat the growing opioid epidemic, the issue of neonatal abstinence syndrome, NAS, continues to grow. NAS is a series of symptoms that occur as newborn babies withdraw from the alcohol or narcotics exposed to them in the womb. These symptoms include body shakes, seizures, restlessness, fever, diarrhea, and high-pitched screams or cries. Many women who are pregnant and abusing alcohol and narcotics are unaware of the effects these substances will have on their child, both during their pregnancy and after the baby has been born. Lack of education, access to care, and growing opioid epidemic are having devastating effects for both mothers and their children. In recent years, the U.S. has undergone an opioid epidemic with 116 people dying from opioid overdose every day in the year 2016. In Maryland, the state saw a 20% increase in opioid deaths from 2014 to 2015, and in March of 2017, Governor Larry Hogan declared a state of emergency. Pregnant women are not immune to the drug crisis. The prevalence of NAS has skyrocketed in the wake of the crisis. The number of NAS cases in the last 9 years has increased by over 56% in Maryland. Due to this escalation, Maryland saw almost 1,500 cases in 2015 alone. However, NAS cases are preventable even when opioid addiction or use is discovered mid-pregnancy. Many women who are pregnant and abusing alcohol and narcotics are unaware of the effects these substances will have on their child, both during their pregnancy and after the baby has been born. In Maryland, nearly 1 in 3 women report not receiving information about alcohol abuse during pregnancy and the effects on the developing fetus. Women are neither receiving sufficient education on their pregnancy nor the care they need. A 2015 report from March of Dimes estimated that 27% of women received inadequate prenatal care in Baltimore. Be More for Healthy Babies is currently a City Health Department initiative that works in collaboration with Family League of Baltimore and Healthcare Access Maryland. BHB has initiatives such as Safe Sleep, Baby Basics, Teen Pregnancy, Smoking, Substance-Exposed Pregnancy, Prenatal Care, and Fetal Infant Mortality Review. Looking specifically at substance-exposed pregnancies, BHB focuses on ensuring substance-free pregnancies and equitable birth outcomes to reduce infant and fetal death and preterm and low birth weights by minimizing the prevalence of substance exposure in utero and postpartum. Shirley Grace Pregnancy Center is a nonprofit medical clinic located in Berlin, Maryland, which offers lab testing, in-home visits, and addiction and adoption counseling. Looking specifically at the Addiction Counseling Service, Shirley Grace connects pregnant women who have an addiction to the relevant program or facility to get necessary care. The in-home visit services follow women throughout their pregnancy and provide recommendations to pregnant women and referrals to go elsewhere to get treatment. The center also offers a support group system for young pregnant women so their voices can be heard. BHB's main initiatives are education, screening, and referrals. However, these programs are offered too late in the pregnancy and substance abuse cycle. To be eligible for these programs, women must first be enrolled in a substance abuse treatment program, which severely reduces the population's access to the program. Shirley Grace Pregnancy Center combats the issue of substance-exposed pregnancies through lab-grade screenings, obstetric examinations, counseling services, and in-home visits. However, Shirley Grace operates exclusively in Berlin, Maryland, in Worcester County, a far distance from Baltimore City, where substance-exposed pregnancies are most prevalent. Our mission is to provide a helping hand to ensure substance-free pregnancies. Through our services, we aim to bring awareness on the adverse effects of prenatal substance abuse and addiction to reduce the prevalence of pregnancy complications, fetal and infant mortality rate, and occurrence of birth defects. Our partnership with CVS Minute Clinic enables us to facilitate the healthcare services to pregnant women in an efficient manner. Care is conveniently available right at your doorstep. Mobile maternity is a service that provides the essential healthcare tools to pregnant women who previously lacked access to health services. We are providing mobile prenatal services such as wellness checks and education on substance abuse to pregnant women that are addicted to and abusing drugs. The purpose of this service is that it lowers the chances of complications during pregnancy and other adverse side effects. Compared to other solutions that are currently addressing the problem, our services will be different in that we cover that gap which is existing in the two current programs. We facilitate the Medicaid enrollment process so that these women are able to access the care they need. They would also be able to receive the substance abuse treatment program services earlier in their pregnancy to avoid the adverse effects that could follow. The mobile maternity vehicle accommodates all the equipment in order to provide services to women who are pregnant. It carries bandages, swabs, needles, prenatal vitamins, portable blood pressure monitor, and ultrasound machines. We are staffed with healthcare providers and social workers to administer and facilitate the necessary services. Our mobile services make these resources more accessible to women who are pregnant and are surrounded by the effects of substance abuse. We are providing education and prenatal wellness checks to monitor health and fetal development. Through education and awareness of the side effects, we aim to increase the number of women who are able to avoid drugs and alcohol during their pregnancies. This will result in more successful pregnancies without complications and lower the infant mortality rates and birth defects. Mobile maternity follows a mixed public and private business model. Our health services are comprised of Medicaid enrollment services and prenatal checkups. Medicaid enrollment is essential to help women through the complicated application process, and the prenatal health clinics operate in collaboration with CVS Health, a private company. Mobile maternity is a nonprofit, tax-exempt organization. Our funding comes from private entities, the partnership with CVS Health, and government aid. Medicaid acts as a private insurer for pregnant women, providing mobile maternity with reimbursement and funding once we enroll patients. CVS Minute Clinic is an established service within CVS Health. Mobile maternity acts as an extension within the CVS family. We build onto Minute Clinic services by providing maternal-focused care. Our partnership enables us to serve low-income Baltimore communities. Because the ongoing substance abuse epidemic and maternal mortality rates require years of effort to make a lasting impact, we anticipate a long-term partnership with CVS. Mobile Maternity partners with the Center for Medicaid and Medicare Services in Maryland and includes case managers who are available through our mobile offices in underserved low-income areas. This helps women confirm their pregnancies and sign up for Medicaid coverage as early in their pregnancy as possible. By partnering with CVS Minute Clinic, we're providing patients with primary medical care in a convenient location for an affordable price. Building upon this partnership, we bring care directly into underserved communities through our mobile treatment centers. Current roadblocks for this partnership are the limited treatments offered by the CVS Minute Clinic. Our mobile maternity vehicles include screening for the 5 common chronic diseases that CVS has committed to treating, as well as ultrasounds and prenatal wellness examinations. In order to conduct research and track outcome measurements, we have partnered with local hospitals. This will provide us with labor and delivery outcomes and statistics. The critical statistic we will examine within the first year of our program is the number of Baltimore babies born with addiction and withdrawals. The data necessary to evaluate our program will include Baltimore neighborhoods experiencing high rates of unplanned pregnancies and substance abuse, prevalence of NAS, and the number of pregnant women enrolled in Medicaid at time of delivery. Our partnership will help us to gather these statistics through patient surveys. The strengths of this program stem from our partnership with local hospitals. This provides us with statistics that are used to determine the status of our program and address areas of potential growth. Our dedication to enrolling patients immediately in Medicaid not only benefits our patients, but also guarantees us payment for our services. Our partnership with CVS Health provides us with financial stability and resources, far more than many other startups or pilot programs would otherwise have access to. A potential weakness of our program is the tedious Medicaid enrollment process, which often requires several types of identifications and documentation that many women whom we aim to serve may not have. Threats that mobile maternity faces are cultural divides, which we tackle by hiring a diverse employee base. This helps to better understand the patient's perspectives. Another difficulty we anticipate is getting women to stick to their therapy and appointment schedule, as many will be recovering or are current drug and alcohol addicts. However, we believe our willingness to travel to women will help us combat this potential threat. The only female character that is shown to be pregnant in The Wire is Kima's girlfriend Cheryl. However, Kima and Cheryl are a contrasting example to the group of women we aim to serve. Kima and Cheryl are not considered to be underserved, as one can clearly see in the show. Aside from David Simon's portrayal of Cheryl's pregnancy in Season 2, there is no clear depiction in The Wire of how underserved pregnant women go through the challenging phases of pregnancy.